Now, cancer diagnosis, as you've just heard, for anyone can mean a huge financial burden over and above just the emotional trauma. For those who can afford medical aid and for state patients, there may be a medical safety net. Nobody, however, wants to think about their child getting cancer, let alone having to plan for it. If you have insurance that includes dread diseases, many don't know what exactly that it means or if children are necessarily included in that insurance. Joining us now is Anton Keet. He is an insurance risk expert. Anton, good evening, and thank you so much for your time. So what kind of insurance do parents need to be taking out in order to ensure that their youngsters will be covered in the event of being amongst the very few who might contract childhood cancer?
Good evening, Liesel, and thanks for having me. Thank you. That's a very good question. Now, one of the types of life cover that you get is dread disease cover, and a dread disease is exactly what the word says. So when you contract a dread disease, then this insurance cover will pay out a lump sum towards to the beneficiary of that policy, to be used in whatever way that you see fit. And in general, people use that to assist with the additional treatment or the additional cost of treatment of cancer. It's not only the health costs, there could also be significant additional costs involved in the entire process.
Sure, and often, of course, the devil lies in the detail. How important is it for people to be able to go through the fine print of whatever policies it is that they're taking up?
It's really, really important that people understand what they're taking up. If you take your policy up through a financial advisor, your financial advisor should explain to you in detail what this policy entails. And at the same time, if you take out a direct policy through one of the direct insurers, then the same would apply. You should make sure that you understand the finer detail. But I have to say, when it comes to these policies, the majority of childhood cancers are included in these policies, and it's a serious matter. So insurers would rather obviously pay the claims than not pay it.
All right, Anton, thank you so much for your time tonight on The Pulse. Anton Keet is an insurance risk expert.